virtually every major psychological diagnosis, whether that's pain, major depression, whether that be generalized anxiety disorder, post-traumatic stress disorder, each and every one of them recognizes at least 2 to 3 significant cognitive difficulties that exist and that become part of the diagnostic criteria. So it's virtually expected in any major psychological diagnosis that there will be a significant cognitive aspect. It's very well recognized. So in that context, how do we then go from the non-traumatic brain injury, non-concussion-based cognitive difficulties to getting a sense of how a person's functioning in terms of their cognitive demands? So brain injury, yes, we use the neuropsychological, neurocognitive assessment. But in the case of the non-brain injured, we consider the cognitive psychological functional ability evaluation, again, putting the individual through a host of cognitive measures, not that dissimilar from neuropsychological test battery, also using occupational aptitude testing and some other related cognitive testing to really get a good sense. And so ours basically become mirrored images. The OTs collect data that's highly relevant, highly categorized, and they have to rate it in a certain way so that we can then map on to their identification of the job demands as to whether the person's likely to meet those job demands or not. Any questions about this? Is this straightforward? Does it kind of help to tie some things together for you and kind of maybe see where some cases you've had some missing gaps, especially here if you haven't been aware of these kinds of assessments?